Across the country, there are also calls to do more and fast to protect Canadians in long-term care. Despite promises to do better after the devastation in the spring, there are multiple outbreaks again and more deaths in several provinces. In Ontario, there are outbreaks in more than 90 long-term care homes now. In the last 24 hours, 24 more residents were reported to have died. Eric Sorensen has more on the troubling trends and why lessons were not learned.
Have we let our guard down, exposing the most vulnerable among us all over again, the elderly in long-term care homes? In Edmonton's South Terrace Continuing Care Centre, one case 3 weeks ago became 146 cases, including 70 staff and 76 residents, 10 of whom have died. Karen Steiner's dad is there. He has advanced Alzheimer's and she cannot see him.
These are very vulnerable patients. They're going to die from neglect is what I fear. The family's really concerned about it. And we can't go in, we can't see them, we can't Skype, we can do nothing.
It's one thing to accept rising case numbers among the young to keep the schools and the economy functioning, but there is a risk in doing so.
The more community spread we have, the more outbreaks are going to happen in our care homes and the more deaths we're going to see. And a stark reminder that currently 97% of those who died of COVID-19 in Canada are older Canadians.
At Kennedy Lodge in Toronto, 29 residents have passed away since early October. The trend in Ontario is unmistakable. The number of active COVID-19 cases in care homes has risen from fewer than 300 last month to more than 600 in recent days. The number of cases among staff has risen steadily to more than 400. And the most troubling statistic, the death toll among residents. On average, there were 2 deaths per day during early and mid-October, now an average of 10 deaths a day over the last week, including 24 deaths yesterday. Ontario's budget last week was criticized for lacking details on promised funding to improve long-term care. Dr. Sinha is blunt. More staff are needed. At the same time, many of them are getting sick.
Especially when a home is in an outbreak, that they continue having the necessary staffing to make sure that the residents are getting the care they need.
In Montreal, the Heron Care Home was woefully understaffed last spring when 38 residents died. Now it is closing down. Residents will be moved. But that is not a solution across the country, where residents and staff of long-term care homes see a deadly disease making a comeback. Eric Sorensen, Global News, Toronto.